Should I have sex in pregnancy? Some say yes, some say no. Why do I have mood swings? I'm happy in the morning and by evening I'm cranky and I don't want to see anyone. Does pregnancy cause all this and why? They said I should take care of my breast even before I deliver. I thought I need it after delivery. So how do I take care of my breast? All this we are going to be talking about in this episode of Nursing with Abby, Antenatal and Motherhood series. Stay tuned. Okay, my beautiful audience, you're welcome to another episode of Nursing with Abby. Today, we're going to be continuing on the series of Antenatal and Motherhood series. And the promises to be so exciting because we're going to be talking about a major topic. Should I have sex in pregnancy? Now, I'm a nurse, I'm a midwife, I'm a public health advocate, and over 8 years of experience, I've gathered a lot of information about this topic. For those who are joining me for the first time, you're welcome to my channel. I talk about nursing, lifestyle, and everything in between. Now, for those of my returning subscribers, thank you so much for the love and support. Thank you. I appreciate. Now, so what do we want to say today? What do we want to talk about today? Sex in pregnancy. Is it good? Is it bad? Obviously, it is good. It was the experience, it was the practice that brought pregnancy in the first instance, isn't it? Now, there are some buts in sex when we talk about sex in pregnancy. The buts are if your health professional, your doctor, your nurse, your midwife tells you don't have sex. There could be a reason, and they're going to explain the reasons to you and the physiology behind such reasons in understandable terms. Now, sex is pleasurable and enjoyable when the two parties consent to it. So there needs to be mutual understanding between the two parties so that there will be a seamless and a beautiful sexual experience. While some find it pleasurable, others don't. Now, remember I talked about 3 trimesters of pregnancy, which is the first trimester, where you probably could vomit, you probably could have some nausea, you probably don't feel good about yourself and all that. Now, at that stage, it's possible that you don't even have the appetite for sex. You don't have the flair for sex because you don't even feel good about yourself. You feel sickly, you feel dizzy, you feel weak, drowsy, and tired. Now, those periods are perfectly normal or okay for you to say, okay, talk to your partner and say, I'm not feeling too well because of this pregnancy. I'll just need to take some time off so that I can, rejuvenate and get better. So it's going to be consensual. Now, by the second trimester of pregnancy, now at that point, you're feeling much confident about yourself and your pregnancy. There's a lot of blood flow through various areas of your body and your reproductive system is not an exception. So even at that time, you could even be at overdrive where you have so much flair for sex. Now at that moment, your tummy is protruding and you feel better about yourself, you love yourself, you may even feel lighter, you may feel more beautiful, you may feel more interesting and fascinating. So you could take advantage of that time and enjoy sex with your partner. Now, the third trimester is when your tummy is already fully bulging and you're almost uncomfortable about even lying down to sleep. Now, at this moment, sex could also be a problem. But it's not a problem if you can find other sexual styles that can help you. Instead of the regular missionary style where the woman lies on her back and then the man comes on top of her. Now, this style really doesn't help pregnant women because it can affect the rate of blood flow back to the heart and it can give the woman a form of dizziness and so much discomfort. But there is another way. We could find the lying down position where the woman lies down to one side and then the husband, assists her from behind. So there are various methods or ways by which we can improve sex even at these later stages. So don't worry. Even if at the first stage you still feel you have the urge, you have to go ahead with it and you're given an okay from a health practitioner, why not? You can. All right. Now, some people would say, must we always have sex in pregnancy? Oh no. It's according to your own tolerance level. You could even be adventurous about your sex life. You could smooch, you could, cuddle, you could just have a kiss, you could, write love notes to one another, you could have romantic outings, romantic dinners, romantic dating, look into each other's eyes, just enjoy the euphoria of being in each other's presence. That's also a way of exhibiting love, and that's also very beautiful. In fact, some people even believe that it's much better than the actual penetration. You can try it and see. As long as you love your partner, you can explore various sexual fantasies and intimacies with one another. Now, somebody would ask, is it possible that while having sex, the semen can just find its way up to the baby and injure the baby? Of course not. Of course not, because the way your womb is being created like a balloon, there is an area at the lower part of your womb, which is called the cervix, which is completely covered during the period of pregnancy by what we call operculum. It's called show to a layman, and that is that show that comes out when it's almost time to deliver. It's a thick mucous plug that covers the mouth of your womb. So it prevents any sperm from finding its way through that part to your baby. So you can see your baby is highly protected. But there are some cases that we might need to take it easy with sex, especially when the woman is undergoing one or two issues, and those issues will be duly communicated to the woman by the health professional. Number one, maybe the woman has issues with the cervix not closing well, or maybe the show has already gone off, maybe due to one reason or the other, or they had to do what we call a cervical sacrilege for such a woman to close up the womb while the baby grows. Now, at that moment, you might need to stay off sex for a while till the cervical sacrilege takes its effect, and then the mouth of the womb is closed till it's time for the baby to be delivered. At that moment, they might say, don't have sex. Another point is probably when you have multiple pregnancies. Maybe you have like 3 babies inside your womb, you have 4 babies, you have 3 babies, you have 2 babies inside your womb. We consider such pregnancies as high risk. Now, such pregnancies, because they're high risk, there's the risk of maybe the babies having a little distress when there is excess or rigorous or frequent sexual activity. But there are some women who still go through multiple pregnancies and they still have sex normally without any problem. So always check with your healthcare provider. For me, I had a set of twins and I was active all through, both sexually and physically. Thank God for that. Now, we could also have, if you have had an history of early births, premature labor, that's what they call it. That means that you deliver your babies before time. Maybe 7 months in pregnancy, you deliver your first baby. 8 months in pregnancy, you deliver your second baby. That means you have a history of preterm births. Now, for people like that, when it is close to that period, would encourage that you stay away from sex for that period so that you don't have the reoccurrence of that preterm births. That's it, okay? Then we could also have, when you have vaginal bleeding, any stage of your pregnancy, they might tell you to stay away from sex at that moment so that we do not aggravate the situation. And you also have some people who the placenta is covering the mouth of your womb. Oh, with that, it's a whole lot, because we don't want the placenta to detach before the baby is born. So they might ask you to hold on sex till they can give you a go ahead or till you deliver. Now, you could also have lubrication, which could also help with sex or sexual activity or intimacy. Because sometimes for a lot of pregnant women, they may feel dry at the lower part, they may feel dry at their reproductive area. So you could have a little form of lubrication to help to encourage the sexual activity. Now, post-delivery, sometimes because a lot of people go through a lot of fatigue after delivery, the stress of labor so much, some people go through a lot of perineal tears. That means that they had to cut you, or you had some tears after delivery. You might really not have the flair for sex at that moment. So there should be an agreement between you and your spouse to make sure that you completely heal before sexual activity commences. One, it helps to reduce the pain, and then it also helps for the woman to be in a better frame of mind before sexual activity starts. Now, we could even have the pressure or the demand of the baby or babies, which might not even make you even have any drive that has to do with sex. This is perfectly normal, and we expect that it would come. It will get better as the day goes by. Some people also have sore breast and postpartum anxiety or depression. all this definitely will just deaden the sex drive. But not to worry, just give it time. Just take your time and let your body heal or recover itself, and then you'll feel that after a while you get much better, and then you can use other methods of love making, smooshing. You could use cuddling, you could use just winking, you could just send love notes to your partner, you could just reenact your pleasurable romantic moments with each other. All those help, they assist a woman to recover and get better to near pregnant state. That means that you get better to when you were not pregnant. That's what I mean. So I don't even I really love this episode because it gives a lot of understanding to a lot of people, and I would love also for men to listen to this, because you'll be able to understand the physiology and the physique of a woman. For a man, seeing his wife, saying his wife, you might believe that why is she running away from me? Why is she not being involved like before? Why is sex not consensual like before? It's because of her hormones and her body system, which is a bit different when she was pregnant. So please try and cooperate with us, understand us, love us the way we are, because we are giving birth to another baby and an addition to the family. So please give us that high level of understanding, and God bless you for doing that. Now, for all of my audience, I hope I've been able to explain a lot of things about sex and pregnancy. If you have any questions, if you have any clarifications, if you have any inquiries, I'll drop my email address for you to just post to me, and then I'll be glad to reply you as much as I can. I'm open to collaborations. I'm open to placement and a lot of joint work, so we can work together to bring about a better and excellent healthcare delivery. So till I see you in my next episode, it's bye for now.